All right, if you want to just make sure your phones and computers are muted, and I will start sharing my screen. Okay, you guys should be able to see my screen at this point. As usual, if you're not with the school or the health department, I just ask you drop off the call and we'll post everything on our website later this week or early next week, and pass along any needed information to others in your departments that might need it. And I just ask everybody make sure that their phone and computers are on mute for me. Thank you. All right, so an update. We had mentioned quite a while back that we were stepping back away from individual case investigations and contact tracing. The CDC also has announced that they don't recommend universal case investigations and contact tracing any longer. This also includes K through 12 schools in their opinion. And so this is a copy and paste right from the CDC. They recommend that we at the health department help you and businesses and others to implement appropriate prevention measures and help support more broad-based efforts to notify people of potential exposures, and that we should help support public education to encourage those with COVID to isolate and to help inform close contacts, those with COVID to inform their close contacts about their potential exposures so that those individuals can properly quarantine, get tested, wear masks, and do other things as appropriate. So again, trying to help you guys make this shift, and we will continue to prioritize investigations of high risk settings such as long-term care facilities, homeless shelters, things like that, clusters, outbreaks, if there's new variants, if we're seeing strange occurrences, things like that. So in this light, of us working to help you to make these shifts, we did send out on Tuesday, I believe everyone on our school mailing list, either Tuesday or Wednesday, should have received 5 documents. One was titled a K-12 school process document, which was 3 pages and had 5 steps. One was a what to do flow sheet, which was a colorful 2-pager that had 7 rows on it. And then 3 were Word documents that were letters meant for you as a resource that you can edit or use as you wish to help with notifications. So I'm gonna walk right through all of those right now, so that we can just kind of go through the process and then cover any questions at the end if we need to. So to back up, we did expect the state to work on something like this, and they still are. They may come out with some guidance. We're not sure when, if it'll be soon or weeks from now. Their guidance may be similar or different. One concept that has been discussed was just a different concept besides household and non-household contacts, more of a concept of high intensity versus a low intensity contact. And if this is too confusing, we understand, but just trying to look at, not just someone in a household, but really someone that you have a high risk of basically swapping saliva with, sharing droplets with, more risk of inhaling COVID from. So the high intensity contact that we refer to in these documents, and I do define in all the documents, but those are people that are household contacts, but also family members that may have visited often. If you have a student who has a boyfriend, girlfriend, or if you have, staff who might have intimate partners, those are high intensity contacts, even if they may not be living together. Kids had slumber parties, those are high intensity contacts. If we're talking about colleges or boarding schools, roommates are included. If you have a staff person who may be acting as a caregiver to a sick family member, that's included. Students who may be sharing food or drink or cigarettes or any other personal items, that's in that definition. None of this is carved in stone. So when we talk about things like sharing a car, again, if they're in the car for a long period of time without a mask, if the windows are closed, that's a consideration. Not so much a bus, because again, they're not usually on the bus for as long and it's a bigger area. If they're in really close physical contact with each other, face-to-face breathing on each other, like wrestling or roughhousing a lot, like little kids might do, or if you have staff that went out to lunch together for an hour. So again, you don't need to get too nitpicky on this. It's more for individuals self-identifying close contacts. The low intensity contacts are everybody else. So those typical 6 feet apart for 15 minutes or more. So pretty much everybody in the school would be more of the low intensity contact. From this point forward, the goal will be that the individual's COVID will be identifying their own high intensity contact. The responsibility to identify them and notify them will be their responsibility or their parents' responsibility. We do ask that if you or their teachers recognize there may be some high intensity contacts in the school that the student may not think about, like if you have a kindergarten class where you saw the sick person sharing a sucker with a friend and that 5-year-old isn't going to think about that, you may want to bring it to the attention of that other child's parents. But we certainly don't expect you to spend a lot of time going through class lists and trying to figure that out. Hopefully this will make more sense as we go along. So just a brief overview is that so individual contact tracing and excluding from school after these lower risk exposures or low intensity exposures is no longer recommended. You should still notify parents and staff if there are exposures, but it'll be a more generalized group notification, and we'll talk about that in a minute. And you should expect or ask for people to wear a mask for 10 days after these exposures, though you really don't need to get militant about it. For the high intensity exposures, those will mostly occur out of school, or again, if they do occur in school, most of the time students will be aware of that, and that'll be the responsibility of the student, staff, or their parents to identify and notify those individuals, and for individuals to take it upon themselves to do the right thing. You are still required by the Public Health Code to report cases of COVID-19 that you become aware of. And if you have outbreaks of any contagious illness or anything unusual, you are required to report those still. So things may change from time to time. We might have new variants, there might be surges, and this is not necessarily hard and fast rules for the rest of the duration, but and things may loosen up more, they may get more strict, but this is what we can work with right now. So basically, if you become aware of someone within your school, a school activity, et cetera, that has COVID or symptoms of COVID, first, find out when their symptoms started or when they were tested. If they did test positive, report the case to us like you normally do. If they tested positive or have symptoms, you can provide them with the isolation guidance letter that we have put together. That gives them all of the information that they need to know regarding isolation and notifying their close contacts. Also on the flow chart, it gives instructions on what they need to do. So this is the letter that we've put together. Again, you can edit it if you need to, but it gives them instructions on what they should do to take care of themselves, how long they need to stay home, whether or not they've tested themselves. and then how they can notify their close contacts. It also instructs them that if any of their close contacts or high intensity close contacts have or do go to school, to let you know who those individuals are. One, so that you know that they should not be going to school, or that they may qualify for test to stay. And we'll talk more about that in a minute. So it does instruct them on there to do that. These are the rows on the front page of that what to do flow sheet. So it walks through, this is something you can provide to the families, and it goes through, I have symptoms and I tested positive, I don't have symptoms and I tested positive, I have symptoms but I didn't get tested and I didn't see a doctor, I have symptoms and I tested negative, or I got another diagnosis from a doctor or a healthcare provider. So it goes through all of those scenarios and what they should do for each of them and what you should expect them to do. So step 4 would be, if they did test positive, let teachers, coaches, et cetera, know, just that if they can think of any high intensity contact that the kiddo might not think of, that you can then make sure those parents know so that they can appropriately be taken care of. And there is a letter you can use for those situations, which advise the individual, their parent, that they should quarantine for 5 days, or they can test to stay, which is the same as it has been, although I did have the end date at day 5 through 7. So you can test a little longer if you want to, just to be on the safe side. It's kind of up to you. So now with these high intensity contacts, so basically your household contacts, allowing them to test to stay rather than mandating they must quarantine. Again, that's per your comfort level. You can take that out if you don't like that part. And then these are the rows of the. So I'm a high intensity contact that's not up to date on my shots and have not tested positive. So I can either stay home for 5 days or I can test to stay. I'm a high intensity contact and I am up to date on my vaccines or have tested positive. So I don't need to quarantine, but I should still wear a mask. And I should get tested after 5 days. So if they did test positive, then you should notify the students and staff with low intensity contacts as a group. So if one kid in 9th grade math is positive, send home a letter to that entire classroom. I know as case rates are still high, this might get a little bit overwhelming, but that is the recommendation, just so that parents can make appropriate decisions for themselves. There is a form letter for that just basically says somebody in your child's classroom has COVID, here are things to consider, here are things we recommend. And then this last row on the flow sheet explains, I've had this low intensity contact and I don't have to quarantine, but I should wear a mask and I should consider getting tested. So that is what we're suggesting right now as a way for you to scale back on contact tracing and investigations. Again, it pretty much puts everything onto the individual with COVID. We certainly know there'll be times when you don't know who has had a high intensity exposure, if they should be in school. You're really not expected to try to hunt down all those rumors of, oh, well, I think Bobby's mom has COVID and he should be home on quarantine. Those are situations where you'll just have to roll with it. If you feel the need to call and try to follow up on those things with families, then you can do so. But we're kind of at a point where, we're just going to have to kind of adjust. So if you have questions, start typing them in, or we'll get back to that at the end of this. I don't have too many more slides. I just wanted to share this. This study just recently got released. It's a look at a study from Arkansas looking at when they had no masking and then when they did in-state masking recommendations, the infections per 100,000 students and staff compared to the community rate without masking, and then when they did in state, either universal masking in their schools or partial masking, which was where masks were required in certain grades or in sports or certain areas, the decrease in the rates in the students. And when they did the breakdown, they found that when they instituted full masking, looking at all students and staff, it cut the risk of COVID by about a quarter, and those with partial masking, it cut it by 12%. And when they broke it down by grade levels, it seemed to have the biggest impact in the older grades. Of course, those are the ages that would have had vaccination, and they did try to do some controlling for vaccination, but obviously that's challenging. But just another study supporting masking in schooling. So to see your local data, you can go to the usual places. The MyStartMap.info hasn't yet updated their map to reflect the new CDC way of doing things, but still has good data there. Getting into the modeling report, and this table or graph is from the CDC directly, not from that report, just to give an overview of what the US as a whole looks like. We still have kind of this slow fizzle out here, but still on the decline. Michigan as a whole, so that was over the last year. This is over the last 3 months. Michigan continues to have this slow decline here, but still definitely going in the right direction. Hospitalizations, much improved, so that is fabulous. And ICU hospitalizations also much improved. Our pediatric hospitalizations are down to 29, so yay, those things are much improved. This is a look at the US and Michigan, our counties that are low, medium, and high. Michigan is similar to the US. We have a little bit more in the medium, a little less in the low, but pretty similar. In the 19 counties on this call, we have 2 counties that are in the high area, and showing our data. This is very busy, I apologize. The main reason these 2 are still high is because the county incidence rate of cases per 100,000 for the prior week are still over 200. And if you look at how they figure the data here, if the new cases for that week were over 200 per 100,000 population, they basically kind of shift the numbers for hospitalizations up, so it becomes a bit less meaningful, which I think is completely appropriate, because you see cases increase and then you see hospitalizations increase later on. So basically it's a way of weighing the community rate a little bit heavier than the hospitalization rates, and vice versa. If you have smaller community levels, the hospitalization levels weigh a little bit heavier. So hopefully those community rates can drop, and then those counties can drop out of the high levels. They do still have a bit higher hospitalization bed utilization too, compared to some of their surrounding areas. Just to kind of show you how that hospitalization data comes about, they do calculate it based on your county population and things, but it is based on health service area hospitalizations. So the hospitalizations for these colored areas. So for example, like here in Clare County, where I'm calling from, it's based on the hospitalizations for COVID in these 4 central counties here. So they are pretty small demographics, and I think it's very reasonable to do that. That's really kind of the only way they can get data like this, but that is the hospitalization numbers they use is for these little health service areas that are in color here. So just a reminder what these colors mean. If you're in high, it is recommended that you continue to wear masks in public, including in schools, and then things get less and less restrictive after that. And these are all recommendations. When we get to medium and low, is not saying that we don't recommend masking. It's just at high level, we are recommending that everyone wear a mask indoors, regardless of the level. Anyone who wants to fully protect themselves from any respiratory illness should wear a mask indoors. We've had some questions about that. So the variant activity in the country, the BA2 variant, kind of the subvariant of Omicron, is at 11.6. Just going to click real quick. Last week it was 8.3, and the week before I think it was 3.8%. So that is slowly creeping up. I think the feeling is still that it's probably not going to become a major issue for the U.S., just might drag that tail out a little bit longer. On a call last week with the state, we have had some detected BA2s in Michigan. Last count, it was less than 30. And as you can see, that's out of thousands of detected Omicron cases. So it's still not felt to be a huge issue at all in Michigan. So just to be aware that, that is being monitored. I think that is my last slide. So I will stop presenting and I will go to questions. Again, if you have any questions, just pop them in the chat, and then at the end we can open up to questions over the phone or computer. So would a high intensity contact be lab or table partners, those that communicate to school or commute to school together, or students who spend the entire day next to one another or not? So we're not really considering any just normal in-school contacts as a high intensity contact. Really, it would be someone who is the equivalent of a household contact. So someone that, the idea behind this being that in-school contacts have really been found to have a very low rate of infection. The absolute highest, most likely to get infected are really household contacts, but just recognizing that there are other people that are like a household contact. So if someone slept in someone's bedroom, like at a sleepover, or if you shared a water bottle, so you actually had direct saliva transmission. I threw in some of those other examples. So if you're in a confined car for an 8-hour trip, that might be a consideration. But if they are table partners, if they are having lunch together, typical school lunch, those you don't need to worry about, unless, again, if they're sharing a sucker or sharing a straw or sharing something where you're really worried about it. And if you're seeing a lot of secondary infections, we may need to revisit it. But our goal at this point is, one, to not make you have to spend a lot of time contact tracing, and two, to keep kids in school as much as possible and at the lowest risk. In the low intensity exposure, we would provide a general notification, expect those impacted to mask for 10 days. How to identify those impacted if contact tracing is no longer recommended? Well, the contact tracing in that situation would be identifying the classmates. So it'd be just basically a class list. So it'd be a down and dirty, simple way of contact tracing. It is appropriate, I feel, to just simply say we recommend you wear a mask for 10 days. The degree to which you want to police that and enforce that is up to you. I would not expect you to put the teacher, I would not expect you to make the teacher enforce that or police it, or to, somehow label kids as to the ones that need to be wearing masks. I would, however, make sure if the teacher has concerns about getting infected from the students who might not be wearing masks and could potentially be infectious, make sure the teacher has a KN95 or an N95 mask available to them. So we're trying to shift to that side of, I know how to protect myself now, so if someone else is not deciding to do that, then I need to do it for myself. Can we report our cases of COVID with just case numbers, or do we still need to fill out the form for every day? So you do need to report name and address and all of that information. I would encourage you to talk with whoever it is at the health department you report to see if there's an easier or better way to do that. You know, in my opinion, you could just at the end of the day fill out like an Excel document with all the needed information for all of your cases from that day or the last 24 hours. But again, I'd have you talk with your nurse from your county and see what works best for both of you. So again, see, you know, if you have 3 that day, you don't necessarily fill out 3 forms. Maybe there's a way you could just do one thing that has all the information. So can I go back to step 3? All right. I am scrolling, hold on, sorry. Okay, so so step 3, this is when, you know, if you send somebody home with symptoms or you find out they tested positive, the isolation guidance letter is just a letter that says, hey, we found out you have symptoms of COVID or you tested positive for COVID. So here's information on how to isolate. And I also threw in there how to continue your classwork during isolation, if possible, because obviously you'll need to provide them some way to do that. So instructions on what they should be doing when they can come back to school, what they need to do when they come back to school. And then if they did test positive, here are the high risk close contacts that you could have. And here's how you can contact your close contacts. There's a resource they can use if they need help doing that. And then if any of those high risk contacts go to school, let us know at school so that you know who is at high risk at school, and also again so that if they can qualify for test to stay. If any of this is not something you want to do, like you don't want to offer test to stay, you can take that out. And then, if you want to, I put in here in red, if you plan to have someone reach out to them about how they're going to continue schooling at home, that kind of thing. And then the other thing in part step 3, you can also send home the flow sheet that was kind of written so that it reads for the person who's using it, and they would follow the front page, which is I'm sick or I've tested positive for COVID, and then they would follow, whichever one applies to them. So I think that should cover that. Can you define up to date on vaccines? I have staff asking about another booster as they are approaching 6 months out from the last one. So up to date is if they are not immunocompromised and they have gotten the mRNA vaccine, it's the 2 primary and 1 booster. There is no second booster or 4th dose yet recommended. If they're immunocompromised and they've gotten the mRNA vaccine, it's a total of 4 doses. So it's still the same, there's been no changes. And I do have a link on, everything has live links to the CDC website where that's defined. Did you say that household exposures, high intensity exposures still require quarantine or not? So for those household or high risk exposures, they should quarantine or test to stay. So even though they are higher risk, we are adding in that they can test to stay, again, trying to increase their students' abilities to stay in school. Those are ones that you may want to be a bit more adamant and strict about making sure that they do mask for the full 10 days because they are a bit higher risk. But again, it's really hard to keep track of, I know. But as much as possible, if we can keep kids that are exposed in school and the ones that are sick out of school for just those 5 days, I think we'll be in a much better place. So even if they've had those household contacts, if you can find a way to test to stay, even if it's using the backpack program or home testing, I think it's worth a try. Again, if you're seeing poor compliance or outbreaks or things, or parents would just say, I'd rather keep my kid home than testing them, you know, I guess that's unfortunate, but it's their choice. Any other questions? That was the last one in the chat. Or does anyone have thoughts on that? Does this make sense? Do you have concerns? All right. Again, the state may come out with guidance which may be similar or it may be different. We'll keep you posted. We've been, at least I've been on a work group with them, and there's been a lot of discussion about that, but we just wanted to make sure you guys had something with resources you could use. So if you think of any other questions, just let me know, and we will get the slides and the recording out to you. And if for some reason you did not get these materials, you know, find out whoever your point of contact is with the health department. They should have gotten them. And if you still can't seem to track them down, you can let me know and I'll get you a copy. So, all right, guys, well, enjoy the rest of your day and we'll talk to you later.